as interest in tumor mutation burden as a potential predictive biomarker grew, a number of studies have now been conducted to look at that in prospective clinical trials. Now, first, let us take a step back and see, why is tumor mutation burden relevant? The hypothesis is, if a tumor has more mutations, it is likely that there will be more mutated neoantigens, and these neoantigens are now recognized by the immune system. So if a tumor has high tumor mutation burden, the immune system has a better chance of seeing these neoantigens and mounting an anti-tumor response. And we've seen studies which show a favorable trend towards outcomes with immunotherapy in patients with high tumor mutation burden. Now, tumor mutation burden can be measured in the tissue, and more recently it's also been studied in the blood, which makes it easier to do it. Peripheral blood now is not only used for resistance mechanism or understanding resistance mechanisms to targeted therapies, but can also be used to look at tumor mutation burden. So the NEPTUNE study was a prospective clinical trial to look at the combination of durvalumab and tremelimumab, basically PD-L1 inhibition in combination with CTLA-4 inhibition, specifically in patients with high blood tumor mutation burden. The trial enrolled patients with blood tumor mutation greater than 20 mutations per megabase, and they were randomized to chemotherapy, standard platinum-based chemotherapy, or tremi plus durva combination. There was a lot of anticipation that this could actually lead to a very simple way to test for mutations and then treat patients. The full results of NEPTUNE have not been reported, but what we heard from a press release was that the study did not meet the primary endpoint. This does raise the question, is it a function of the biomarker being not sufficiently good to predict for which patients will benefit, or is it that the regimen of tremi and durva was not sufficiently efficacious to improve outcomes for patients? And we'll know more as the results of these studies report out. There are other studies with durva and tremi that are being studied. There's a study of chemo plus durva and tremi compared to chemo alone that's ongoing and has not been reported, so we will look forward to those results as well. There's also another trial that compares durva to chemo in patients with advanced stage non-small cell lung cancer in the frontline setting. So the role of where durva fits in the front line and what's the role of durvalumab plus tremelimumab are still open questions. What this tells us from the NEPTUNE press release tells us is that the blood-based biomarker using 20 as a cutoff was not helpful in identifying which patients will benefit from the combination of durva and tremelimumab.